Good afternoon. Thank you for joining us. Well, BC's Provincial Health Officer Dr. Bonnie Henry and Health Minister Adrian will speak to discuss COVID-19 masking and fall vaccination. The focus of masking will be on healthcare settings, things like hospitals, residential care, and doctors' offices. We'll take you to that press conference live as soon as it starts, and we'll take your reaction later on this hour. I'm Michelle Eliot. Welcome to BC Today. Let's go live now to Health Minister Adrian.
It's my honor to begin by introducing Dr. Bonnie Henry to discuss the respiratory illness season. Dr. Henry.
Thank you and good afternoon. Whoa. I just want to start as well by acknowledging that coming up this Saturday is our National Day of Truth and Reconciliation, September 30th, and I encourage everyone to actively participate in learning the truth about the residential school system, Indian hospitals, and the impacts it's had on First Nation communities across this entire province, and actively advancing together and elevating true reconciliation as a way forward for us in this country. So today we're going to talk about protecting BC in this respiratory virus season. Let's see if I can make this move. Okay. First, I want to give a sense of what happened last year and where we are to put this in perspective. So last year, we saw the return of other respiratory viruses like influenza and RSV, amongst a number of others. And you can see on this graph, the green, for example, are enteroviruses and rhinoviruses. Those are the cold viruses. And we've seen those persist through the summer as well. To summarize it up, what we saw last year was that SARS-CoV-2 really was fluctuating through the year, mostly in adults and causing more severe illness in adults, and we'll talk a bit more about that. We had a relatively early influenza season with a sharp, short spike, and it impacted children more than we have seen in the past. As well, we had a relatively severe RSV season, which also affected mostly children, higher than our historical averages. So we know that much of this is related to the fact that we had return of global travel and that these viruses circulate with people and we move around the globe. And it's important that we recognize that this movement of people is also part of how we, important for our economies, important for our health, important for being able to get together after the years that we've been through. The Southern Hemisphere can give us some indications of what we might expect this year. And what they saw was, again, variable COVID over the period of their respiratory virus season. They also saw influenza H1N1 and influenza B. And we're starting to see that that might be what we would see here. Again, those are viruses that particularly affect children. So that's something that we'll be looking out for. And they also saw a variable RSV season. So I want to go back and just look a little bit and put it in context for what happened in BC last year. So as I said, in the blue there, you can see we had an early sharp influenza peak. But if we break it down by age, we can see that very young children are the ones most affected. So infants up to 4 years of age in particular, but also children in school-age children as well. And with all of these viruses, we know that people over the age of 70 have the highest risk of having severe illness, ending up in hospital, or having complications from these viruses. So we have that U-shaped curve where very young and older people are more affected. We also saw that COVID particularly affected older people, while there was also some increased activity in the very young who are most at risk. People over the age of 70 were more likely to have severe illness, more likely to end up in hospital. So the double risk that they have of these two viruses really speaks to the importance of the protection that we need from the updated vaccines, both for influenza and for COVID. So this slide is a little bit busy, but I want to talk to it for a minute. We know that protection from vaccines and from infection, it wanes over time. So it decreases over time. But there's two different parts to that is important. It never goes back to zero. So what we know from the seroprevalence, so that's that graph on the top, the seroprevalence, that's markers in the blood of people who have antibodies against COVID. And we know that some of these antibodies are from vaccine, and some of these antibodies can be from infections. So that's the bottom line. What we see is that over time, just about everybody in this province has some protection, has antibodies to COVID-19. And that's a combination of vaccinations, people having 2, 3, 4, sometimes 6 if you're somebody who's immune compromised, and having infections. Particularly, we've seen those infections markers increase since Omicron started. Many of these people, particularly people who are vaccinated, didn't even know that they had an infection with Omicron because they had protection from severe illness. So that's the thing that's important. It never goes back to zero. We know we have this cell-mediated immunity or memory immunity, and once you have vaccinations or combinations of vaccinations and infections, that immunity is long-lasting, and we're learning that now from the studies that have been done over time. We also see that this hybrid immunity is different in different age groups. So what does that tell us? That tells us that young people are more likely to have had combinations of vaccination and infections. We know that people who've had no vaccination, most of them have had some indication of infection if you're younger, but those can wane over time. So unvaccinated people remain most at risk for severe illness and hospitalizations as we're heading into this next respiratory virus season. We also see that older people are less likely to have markers of infection. And what does that tell us? That tells us that vaccination has been really good at protecting older people. But it also means that they don't have this hybrid immunity, and it's really important that we get boosted and we get this updated vaccine to protect us from infection with the viruses that are circulating right now. This is also relevant to the healthcare worker mandate, because if we look at that age group that most healthcare workers are, we know that all healthcare workers in our system right now have vaccination. Most of them have multiple doses, at least 2, but almost everybody has had at least 1 booster. And we know that many of them also have hybrid immunity. The majority of us have hybrid immunity from infections and exposures to Omicron over the past year. So that gives us a really good buffer. But what we need to focus on now is this updated vaccine that will protect us from what's going around right now and give an extra boost to that long-term immunity that we still have. So this is the graph of what we're seeing right now in terms of COVID specifically for hospitalizations on the top and critical care admissions and deaths. So the hospitalizations are test positive. So people have a PCR test, and we know that mostly that's people who are in hospital for other reasons, and or people who have more severe illness, so they get a test from their doctor, a PCR test. For this, we recognize as well that test positive in hospital people, and people who are in hospital, about 40% of those cases are people who are there because of COVID. And we know right now we've had a bump up in the last few weeks because there's been a few outbreaks and clusters, and so we've been doing a lot of testing at people in hospital. So it's a combination right now of people who are asymptomatic, people who have been in hospital for something else, who got a COVID test that's positive and that we need to pay attention to, and for people who actually do have COVID. So those are things that we follow over time, and it tells us that, yeah, we're starting to see more COVID in the community, and I think that's no surprise to people. We're also starting to see other viruses that cause infections. We're seeing a little bit of influenza. We have not seen much RSV yet, but those are the ones we're looking for. Throughout this pandemic, whole genome sequencing has become a really important tool that helps us understand how the virus is changing over time. And this is something that we know all viruses change and they mutate as they try and be better at infecting people. And what we've seen, and it's sort of in big letters there, is really since early 2022, it's been various different strains of Omicron. And it's a key part of understanding the changes. And it is relatively new technology. This is the first time ever we've been able to sort of watch a virus change in real time. So we sometimes pay a lot of attention to, it's XBB 1.5, it's XBB this, it's EG 0.5, and those are the ones that we're seeing circulate around now. But really, what we want to know is the vaccine still going to protect us? What is the advantage of this virus over the previous ones that were closely related to it? Is it causing more severe illness? So those are the things that we are monitoring as well. Right now, what's important is it has been Omicron. There's been slight changes, so these are all related to each other. What we're seeing here in British Columbia is XBB 1.16, EG 0.5 are the ones that we're identifying most commonly. So far, we've only had the one identification of BA 2.86, which is a slightly distant cousin. But there are many, many other slight variations that are circulating around here now as well. And the important thing is, studies are shown from the clinical trials, from lab studies that have been done, that the vaccine that has been developed, this new updated vaccine, XBB 1.5, it's based on that, shows good protection against all of these ones that we're seeing circulate right now. So that's good news. I want to also say just a word about testing. So the rapid antigen tests that are still available around in pharmacies right now, they still work. And we've been monitoring those to see if they pick up these new strains as well. And they are still helpful for people who are isolating at home and have milder illness. It helps you know if it's COVID. But we need to remember that COVID is not the only virus that's causing people to be sick right now. Just to move on, one of the other tools that's been so helpful for us since the pandemic started is looking at wastewater surveillance. And what that gives us is a sense of trends over time in different communities. And as you know, we've expanded the wastewater surveillance to more areas around BC, and it helps us as a passive way of looking at trends. So all of these are pieces of a picture that help us understand what's going on right now. So we are seeing gradual increases. It's still relatively low, but gradual increases across the province. What will be new over the next few weeks, you'll see, is that we've been able to, the scientists and clinicians at the BC CDC have been working hard to validate tests for other respiratory viruses that we can check in wastewater as well. So it is kind of exciting that we're doing this. It's new in Canada, and we'll be looking for influenza A, but also for RSV. And we don't know a lot about RSV and what strains circulate and how it changes over time and why some years we have more severe seasons than others. So all of these will be available in the BC CDC dashboard that you'll be able to follow over time as well. The other addition that we're adding that's new this year on the dashboard is emergency department visits for what we call the syndrome of respiratory illness. So it's how many people are presenting to an emergency department with a cough and a fever and other signs of respiratory illness that are indicative of what's going on in the community. So it's a syndrome, we call it syndromic surveillance, and you'll be able to follow that over time. And what we're seeing right now in this picture is that we're starting to see a slight increase. This will also be available on the new dashboard. So just to put this up, we've been reporting monthly over the summer when rates of respiratory illnesses were low across the province. And now as things are ramping up, and we know that we traditionally see more respiratory illnesses as we go into this season, we'll be increasing the frequency. And so starting October 5th, these will be available on the BC CDC website on a weekly basis. And you'll be able to look at all of the COVID-19 updates, but also the respiratory disease updates all together on that webpage. So that's important. That's what will help us know where we're going and the trajectories over time. So what else do we need to do to prepare as we go into the fall? It's really going back to what we all know, and sometimes maybe a bit tired of, but the healthy habits that keep us from getting sick ourselves and also keep us from passing it on to others, particularly to our loved ones and others in our community. So we know that influenza, COVID, RSV, enteroviruses, adenoviruses, all of those things that cause respiratory illnesses tend to come back as we go into the fall and winter. Really important is staying up to date on both influenza and COVID vaccines, and I'll talk a minute about what we have available for those. Staying home if you have a cough and a fever, those are signs that you're infectious to others and you need to stay away. Particularly staying away from people who are more vulnerable. So if you're not feeling well yourself, even if it's mild, don't go visit somebody in a long-term care. Postpone that visit if you can, or take precautions to make sure you're not going to expose somebody who might be more at risk. Cleaning your hands regularly, covering your coughs and sneezes, even wearing a mask if you have mild symptoms or if you're recovering and you're going to be in an indoor space with people who might be more at risk. I do want to say a minute about testing. I mentioned that the rapid antigen tests that you can get still work, and they're important to use. They can tell you if you have COVID, but they won't tell you if you have influenza or one of those other viruses. So even if it's negative, it's important to stay home and stay away from others until your symptoms have resolved, and particularly until fever has resolved. If you are somebody who's higher risk, or you have more severe symptoms, then you should see your healthcare provider. And in that case, you'll likely get a PCR test. And as we did last year, all of the PCR tests, they go to the lab, they're tested for 5 viruses. So it's called a multiplex test. So it tests for influenza A, influenza B, for COVID, for RSV, and for another common virus that can cause some severe illness as well, parainfluenza. And that's important. If you are somebody who's at higher risk, you can have access to antivirals that can help treat influenza and to medications like Paxlovid for COVID. So the updated COVID-19 vaccines are available. They're just starting to come into the province now. The recommendation is you get it about 6 months after either your last known infection or after your last dose. But we know that this improves long-term protection, so you get the best longer-term protection if you wait about 6 months. But we also know that this one is tailored to what we're seeing circulate right now. So it prevents infection. So it prevents us from getting the virus causing infection in the first place. That immunity, the antibodies that give you that protection against infection, they increase, and these are questions that I've been asked quite a lot over the last little while. So it's not immediate. It increases about a week to 10 days till you get that maximum protection. And what we're learning is that after each dose, that maximum protection against infection can last for 2 to 3 months. So we want you to get the vaccine, and that's the timing. We want you to have that best protection during the period of time when the risk is greatest. The other thing, though, is that cell-mediated immunity, that memory immunity, and it gets a boost from this vaccine as well, and that lasts quite a bit longer. So we know that these are both mRNA vaccines. Oh, yes, and the big news today is that the Pfizer Comirnaty Omicron vaccine was approved for use by Health Canada this morning. So we have the 2 mRNA vaccines that have been approved by Health Canada, and that will be rolling out in the next few days and weeks here. Everybody 6 months of age, and these are approved for use for people 6 months of age and older. And we're still waiting for the Novavax, the protein vaccine, but that has been submitted to Health Canada as well. So that's the COVID vaccines. In terms of influenza vaccines, we have a variety of injectable. Just to remind people, there's a nasal spray vaccine for young people. It's approved for use in 2 to 17 years of age. And we have two enhanced vaccines for seniors over 65 years of age. Both of these vaccines, the Fluad, which is an adjuvanted vaccine, and the Fluzone high dose, give added protection for seniors and have been proven to provide added protection for seniors. So those are available as well. Our campaign will be starting as soon as vaccine comes in, and we are starting with long-term care even this week. But the public campaign will really launch in earnest, so most people will expect to start getting invitations to get your vaccinations starting right after the Thanksgiving weekend around October 10th. We are rolling out, as I mentioned, priority groups early on, and everybody should be familiar with the getvaccinated.gov.bc.ca. You can register, make sure you get your invitation, or the call center number remains the same as well, 1-833-838-2323. And I do encourage people to get both vaccines at the same time. If you're not yet due because you've just had a recent booster for your COVID vaccine, important to get your flu vaccine and then get that one when you're due. And there will be over 1,300 pharmacies around the province that will be offering both vaccines and additional capacity from public health units. Just to remind people in terms of eligibility for both vaccines, they're free for everybody in BC 6 months of age and older. We are going to invite priority populations first for the reasons that I just talked about. We know that most people who are over age 65, who are immune compromised, it's been some time since they've had a vaccine that gives them protection since the spring dose. And we know that most of them, the vaccines have prevented them from getting sick with the virus. So they're the ones who need it first. We'll be also providing it to residents of long-term care home, people who are pregnant, and infants and young children. In particular, we want to make sure they're protected against influenza because we know that they can get severe disease from influenza. And we'll be rolling it out to healthcare workers as well as soon as it's available. Finally, I just want to talk a little bit about additional infection prevention and control measures in healthcare settings. And so this is something that as we had low levels of respiratory viruses circulating through the summer, we were able to remove some of the additional precautions that were needed in healthcare facilities. But starting next week on October 3rd, we're going to be putting back in some of the measures to make sure that we're doing our best to protect people who are most vulnerable in those settings. So active screening for symptoms, you'll be asked at the door whether you have respiratory symptoms. Visitors who do will be asked not to attend, particularly in long-term care. We know that it's really important to protect our seniors and elders in care. Healthcare workers as well. We have a process for doing self-screening, for making sure that we have return to work guidance and know what to do with that. Increased hand hygiene, increased cleaning, what we call respiratory etiquette, making sure you cough in your sleeve, clean your hands regularly. And the ambassadors will be back at the doors of the entrances to healthcare facilities and to long-term care homes to do the active screening, make sure people have access to masks. And finally, medical masking will become a requirement again, continuing medical masking by healthcare workers, visitors, contractors, volunteers in patient care areas. So really focusing on those areas where people are at risk. And that includes all health authority, hospital, clinical settings, all long-term care homes, seniors assisted living settings, private hospitals, and private mental health facilities. We are trying to find a balance, particularly in long-term care, of finding safe times for visitors to long-term care to have that important face-to-face contact with their loved one in a safe way. So visitors to long-term care must wear a medical mask in all common areas and when participating in any of the indoor events that are happening. But we're finding opportunities for them to have face time with your loved ones as well. We know how important that is for the health of residents in long-term care homes. So that's the summary of what we're seeing. So really important. Get up to date on your vaccinations. Expect to wear a mask if you're in a hospital or a healthcare setting in the next few months. And that's the best we can do to protect each other and to make sure that we can slow down and minimize the impact of these viruses on ourselves, on our communities, and on our healthcare system. And I'll now turn it over to Minister Dix to talk about the healthcare system.
You're listening to Dr. Bonnie Henry speaking there about the immunization campaign that's going to be rolling out in British Columbia for COVID-19 and the flu as well. And as she stated there, for long-term care, healthcare workers, immunizations will begin as soon as those vaccines arrive in the province. Meanwhile, the public campaign will launch on October 10th, and invitations will start to roll out early October. That will be by priority group. And medical masking will be required for healthcare workers, visitors, contractors, and volunteers at healthcare facilities, as well visitors to long-term care and assisted living facilities. Seniors facilities must wear a medical mask in all common areas. I'm joined now for some reaction, and we'll get a quick comment here from Dr. Joshua Gan, who's president of Doctors of B.C. Dr. Gan, thanks so much for being with us this afternoon.
Thank you for having me today.
What are your thoughts, first of all, on the schedule of the vaccination campaign and the return of medical masking requirements for healthcare workers?
So what I've appreciated is the data to sort of inform that we are getting more COVID, we are getting more hospitalizations. And so we always want to be judicious and cautious with regards to what's coming next. And so although no one loves the idea that we have to go back to where it was before with masking, I think this is the right move at the right time.
When you say no one loves the idea of going back, do you foresee any issues with that? We're talking about healthcare workers right now.
Yeah, specifically with healthcare workers, there are some annoyances to wearing a mask all the time, specifically when facing patients, both with regards to communication, but also just the wear and tear on your ears. I think, however, again, as we move into respiratory season, healthcare workers and physicians in particular will recognize that we're trying to protect our most vulnerable, both our very young, as Dr. Henry showed, but also our elderly and vulnerable.
Okay, very good to have you with us this afternoon. Dr. Joshua Gan is president of Doctors of B.C, and he'll be back with us coming up in the next half hour as well. We're also going to get reaction from the BC Nurses Union, and we'll take your calls, your thoughts on medical masking at healthcare facilities required of medical workers, healthcare workers, and we'll take your calls on that. 1-800-825-5950, 604-669-3733. We'll be back right after the CBC News Update with Robert Zimmerman.
Good afternoon. Vancouver police are investigating a homicide in the downtown east side. A man was assaulted early this morning and died later in hospital. The victim has not been identified. No arrests have been made. Rain has brought relief to some drought-stricken areas of BC. Vancouver Island, the Lower Mainland, the Sunshine Coast, and the Eastern Pacific Range, which includes Whistler and Hope, have been downgraded from drought level 5 to 4. But in northern BC, 4 watersheds, including the East and North Peace, have gone in the opposite direction. And as we've been hearing on the show, the province has announced that masks will be mandatory in healthcare settings. It applies to hospitals, care homes, senior centers, and mental health facilities. The new rules go into effect next Tuesday. And now the forecast on the north coast, a chance of showers this afternoon with a bit of sunshine and a high of 13. Smoky and cloudy with highs up to 14 in the Peace. In the central interior, a high of 8 degrees with showers and a risk of thunderstorms. Highs up to 13 with a few showers in the Kootenays. In the southern interior, a chance of showers and thunderstorms with a high of 14 degrees. And for Metro Vancouver, Greater Victoria, and the Fraser Valley, a mix of sun and cloud this afternoon, with highs up to 16. I'll have more local news at the top of the hour. Now back to Michelle with BC Today.
Thank you very much, Rob. Robert Zimmerman in the CBC Vancouver newsroom. Welcome back. This is BC Today here on CBC. We're on Radio 1, 88.1 FM in the Metro Vancouver area. We're live streaming too on YouTube. You can search for CBC Vancouver. You can use the CBC GEM app or go to our main website, cbc.ca/BC. Thanks so much for being with us. And we have been bringing you live a news conference during which Provincial Health Officer Dr. Bonnie Henry announced the rollout for immunization of COVID-19 vaccines in BC, as well as a return to some of those healthcare requirements when it comes to masking specifically for healthcare workers. So there are now 2 vaccines approved in Canada. Health Canada has approved Moderna's Spikevax vaccine. And as of today, Dr. Henry mentioned the Pfizer-BioNTech Comirnaty Omicron vaccine has been approved as well. And so for long-term care workers, healthcare workers, immunizations will begin as soon as those vaccines arrive in the province. And for the public, that campaign will launch on October 10th. And there is a phone number as well and a website for you to go to make your appointment. That is getvaccinated.gov.bc.ca. Or you can call the phone number 1-833-838-2323. Now, Dr. Henry also mentioned that starting October 3rd, they will be putting back active screening and other health measures as well at healthcare settings. And that includes medical masking to be required for healthcare workers, visitors, contractors, and volunteers at healthcare facilities, as well as visitors to long-term care and assisted living facilities must wear a medical mask in all common areas. I'm joined right now by Dr. Joshua Gan, President of Doctors of B.C. Good to have you with us.
Thank you, Michelle.
And can I get your thoughts on the vaccination campaign as well? I understand that perhaps other jurisdictions have already gone ahead or are further ahead when it comes to immunization. What do you make of the timing of the campaign in British Columbia?
There was some cautiousness as far as timing is concerned. Again, looking at the data, how much COVID was happening, and then the availability of the vaccine. As you remember, back in 2020, there wasn't vaccine, and then suddenly there was vaccine. And so trying to roll it out to our most vulnerable, our elders, and the ones who are facing long-term care facilities or our healthcare workers. And so I think it always feels like it could be faster, but now that it's here, I think it's good timing.
And so what level of protection might it offer us, given we have seen that bump already, as we saw from the slide, right? That bump over the last few weeks in September of cases in hospital, whether it was people who arrived in hospital and got tested there or came showing symptoms. Can you just take us through what this might mean for those numbers in BC, given that COVID has already been circulating?
So COVID's been circulating since the start of the pandemic. Right now, there's a bump up
more of it.
as more of it. And so again, probably because of returning to school where viruses, I know several of my colleagues and friends have had kids go to school. And as Dr. Henry said, not just COVID viruses, but other things, including influenza, RSV are likely coming. And so it's difficult to say for sure, what will it eliminate it? No, the expectation with things like masking and again, a renewed vaccine campaign, that will start to mitigate it or reduce the risk as best as possible, specifically, as always mentioned, for our elderly, for our frail, and for our vulnerable.
Okay, and so she did say, Dr. Henry did say that the invitations will be sent out according to priority group. Perhaps you can tell us again who those priority groups are. You've just touched on that a little bit, but if you can just elaborate on who can expect to get those first invitations.
And so I'm not exactly sure of the exact rollout. Historically, it's been based on age group. We know that age is the highest risk in addition to a few complex medical disease. I would imagine based on the same system they've been using for some time, which again, sent texts or emails. I'm not sure if that's happening again, but will generally go by age to the best of my knowledge. I believe Dr. Henry said sort of starting after age 65. And so again, the information flow is always a challenge, but I think the principle of trying to protect those most at risk makes good sense.
Okay, we are taking calls from our viewers and listeners as well, asking you what your thoughts are, your reaction to the return of medical masking for healthcare workers. Let us know what that's like for you if you do work in the healthcare system, if you're a nurse, a family physician, and other worker as well. What does that mean for you? Have you been masking already? And if in any setting, have you already gone back to masking? I know I've seen them around more often over the last couple of weeks. So you can let us know what your approach has been and will be in the coming weeks. And are you planning to get a fall vaccine as well? 1-800-825-5950, 604-669-3733. You can hit pound 690 on your cell phone. If you want to reach us by email, it's bctoday@cbc.ca. And if you have any questions about the Omicron variant that's circulating right now and what you'd like to know about it, you can give us a call as well on that. And we'll take your calls with Dr. Gregan in just a moment. Right now, for more reaction, we are joined by Adrian Gear. She's president of the BC Nurses Union. Adrian, good afternoon. Thanks for joining us.
Good afternoon. Thanks for having me.
What will these recommendations and the requirements for medical masking mean for your members?
Well, we believe that, medical masking is really the prudent decision to make right now. We know that we are going into respiratory illness season this fall and winter. COVID is still out there. And so, we support this decision.
In the past, there has been some resistance from nurses in BC to certain policies, in particular vaccination mandates. What are you hearing from your members right now?
The BCNU, we certainly encourage, nurses and other healthcare workers, the general public, to be vaccinated against communicable diseases. It makes a lot of sense in terms of a preventative measure, and it's in accordance with the most recent science. At the end of the day, nurses are highly educated healthcare professionals. The vast majority of our members support vaccination, and I suspect that plays true today.
And we did hear from the Provincial Health Officer that the ambassadors would be back, returning to the front doors of those hospitals and healthcare settings to do that initial screening and to ensure that masks are made available. What role do nurses play, if any, in enforcing or asking patients to perhaps wear a mask? And at this point, it's upon the directive of a healthcare worker or on personal choice. So do nurses play a role in that at all?
Well, I think nurses play a role in terms of, education, but not enforcement. That is a responsibility of the health authorities, and nurses should not be put in that position of having to enforce a policy.
Okay. What are your thoughts then on the vaccination? Have you heard any word as to when the vaccines would arrive in BC, putting healthcare workers at the front of the line for getting those shots?
I don't have exact information. I certainly, on the briefing today, heard, October 10th, and understand that healthcare workers would be considered a priority population, but I do not have any additional information than that.
Okay. You expect to hear from the province, I assume.
I imagine there'll be some more information forthcoming. Again, healthcare workers would be considered a priority population, and understand that the vaccine would be certainly made available to healthcare workers before some other groups.
And finally, Adrian, we heard about the increasing cases in hospitals over the last few weeks in September. What impact does that have on nurses and the workload that they have in those healthcare settings?
Yeah, so great question. I mean, we know we're going into RSV season, influenza, COVID. As it stands now, we don't have enough nurses in this province to take care of the demands now. Patients require care, and there's just simply not enough nurses. So this does make for a very challenging situation if this season, is serious in terms of, the impacts on patients that are getting sick. If it turns out that patients are going to require hospitalization, that is going to put additional strains on the system, and certainly on nurses, but on, physicians, other healthcare workers, on any given day. Like we are over census, which means that we have more patients than we have funded beds. And, the situation is already very concerning and in fact critical at sometimes where there's just simply not enough staff. So this is a real concern, and certainly, we worry that we're going to see the need for more hospitalizations over this respiratory season, and that's why I believe it's very important that all British Columbians consider this recommendation for sure. In terms of having the booster vaccine, that's something that everyone should consider doing. But masking and masking does serve as a way to mitigate the risk of becoming ill. And so, I think everyone needs to do their part so that we can not overload the system because it's already under incredible stress.
Adrian, good to hear from you this afternoon. Thanks so much for joining us with your reaction.
Thank you very much.
Adrian Gear is president of the BC Nurses Union. And you're with BC Today here on CBC on Radio 1, live streaming as well. We're taking your reaction to the announcement made just about a half an hour ago in the last hour by Provincial Health Officer Dr. Bonnie Henry, saying that the vaccine campaign for boosters, the fall vaccination campaign for COVID-19 will begin for long-term and healthcare workers as soon as those vaccines arrive in BC. No date set yet, according to the BC Nurses Union, or as far as they're aware, they have not been told yet. But the public campaign will launch on October 10th. As well, next week, October 3rd, that medical masking rule will come back for healthcare workers, and visitors to long-term care and assisted living facilities must wear a medical mask in common areas. Taking your reaction to this now, 1-800-825-5950, 604-669-3733. And Paul is joining us from Oliver. Hi there, Paul.
Hello.
Thanks very much for calling in. And what's your reaction to the mask requirement for healthcare workers and when the vaccinations will begin?
Well, I'm not shocked that we're going back to masks in the hospitals and care facilities because the vulnerable need to be protected. So my concern is the general public. Like, it seems like the mandate is reactive instead of proactive. It's like, why can't we protect the population in the bigger businesses like Walmart, like Superstore, where there's people like more than 100 people or 50 people could go there. They should be wearing masks as well and stopping the spread of the virus.
You'd like this to go further then? For
Like,
yourself,
we're all coming in the hospital all sick, and we have to deal with it.
yeah. For yourself, do you have any particular concerns, personal concerns?
No, not at all.
Yeah. Okay. And what did you make of the point there from Adrian Gear of the BC Nurses Union saying, hospitals are already stretched in light of the viruses and illnesses that they're seeing. And so this would be a way to try and curtail the spread. What did you make of her comments about the impact on hospitals right now?
Well, she's right that there is no staff. And when we get inundated by patients with viruses and respiratory illnesses, it's just going to overwhelm the system.
Okay, Paul, thank you very much. Good to hear from you and Oliver.
Okay, thanks.
You take care. And so that's Paul calling us from the Okanagan. At Oliver, love to hear from you as well. What's your reaction to the medical masking focusing right now on healthcare workers or focusing on healthcare workers? Do you agree with Paul that that should be extended? What other settings do you think should be prioritized? Or do you feel that this is a prudent move? Love to hear from you. 1-800-825-5950, 604-669-3733. You can hit pound 690 on your cell phone or email us to bctoday@cbc.ca. Dr. Joshua Gan has been my guest. He's president of Doctors of B.C. And I want to get your reaction to Paul's comment there that what he's worried about is general settings, public settings. And he says there should be masking required there too.
So I think I'll respond to Paul in that you always have the option to mask. It's never like you are never forbidden to mask. And if you're in large group settings or on airplanes, I think it's completely appropriate to take care of yourself and the people around you by masking. I don't think there will be any, blowback from that. I also acknowledge that this is the first step, and it may come to fruition where we go back to masking in large settings. I know personally we have, gathered as a family, or we have gathered as colleagues in large groups over the summertime, and I've really enjoyed the social connection. And I heard Bonnie Henry say the word balance. We're trying to balance the risk versus trying to balance the risk of not connecting, not socializing. I know that's an ongoing dilemma.
Okay, and we are heading to the Thanksgiving weekend as well, so that's going to be a time when many people will be gathering. Let's put out the phone numbers once again: 1-800-825-5950, 604-669-3733. You can hit pound 690 on your cell phone. You can email us, and Hillary writes, I'm wondering if healthcare settings includes labs and those types of medical services. Okay, so when you visit a lab to get some blood work, for example, or any kind of screening, Hillary's asking if that would be included. I don't know if that's something that you would be privy to, Dr. Gregan.
I didn't see it explicitly listed, X-ray or lab, but my presumption is yes, those would be considered patient-facing areas. And so not only are the healthcare workers, I would imagine, being expected to mask, but then as a patient, I would encourage you, as Adrian said, to be involved in the solution before it gets to be more of a crisis by let's be responsible together.
Okay, let's take another call now. Glenn is on the line in Vancouver with a question. Hi, Glenn, welcome to the show.
Hello.
What do you want to know?
Yes, I am really curious as to why we haven't had an update yet on the RSV vaccine, which is already rolling out in Ontario and has been federally approved.
Okay, and what are your concerns about that? We did hear that last year we had an early RSV season, not seeing it so far, but certainly something that they're watching for. What are your concerns specifically?
Well, I was sick last year for 9 weeks with it.
Oh my goodness!
And I just had surgery 2 weeks ago, so it's I want to take all of the precautions that I can.
Fair enough.
I've been masking for a couple of weeks before the surgery and ever since. So it's the seniors and vulnerable are I think should be protected. I'm also a little concerned. I've heard I talked to a pharmacist. He said that this shot is not going to be covered, and it's going to be about $300
for RSV.
Yeah, that's kind of a big hit. But it would be nice to know exactly when it's rolling out, or what stage they're at right now in BC.
Yeah, that's a good question, Glenn. And that was the one vaccine that Dr. Henry didn't talk about. She talked about influenza and COVID-19.
Exactly.
Yeah. Well, I'm sorry you were sick for so long last year.
It was miserable.
Yeah.
Okay, thank you.
I bet. Thanks so much for the call. Yeah, it's a good question. Dr. Gregan, have you heard anything about that, and how are things going in Ontario, if you're aware?
I'm not aware of Ontario specifically. I know, as the caller had said, that there was an RSV vaccine that's being rolled out primarily for elders or people over 65. But I don't know, again, based on how the vaccine rollout is going there, I don't know the target of who they exactly are targeting. And as Dr. Henry said earlier, we haven't seen a lot of RSV yet in this province, although she did reference last year in December when particularly BC Children's Hospital was quite overrun with a lot of RSV, which again wouldn't be the group that's being targeted for vaccines currently for RSV.
Yes, in Ontario, just looking at some of the articles right now, they are covering the RSV vaccine for nursing home residents. And they about a couple of weeks ago, Ontario unveiled its fall COVID-19 and flu shot plans. And you talked there about the impact on hospitals, right? And Adrian Gear from the BC, and you discussed that as well. We heard from Glenn there talking about the weight, the workload, and just how stretched hospital services are. What did you see last year, and what are you hoping changes this year?
Yeah, it wasn't just last year. It's continued through the summertime. It's an ongoing struggle. And Adrian absolutely says it correct. It is a human health resource challenge with nurses and physicians and a myriad of other, lab technicians, x-ray technicians, porters. And so for sure, the crisis we're facing right now is the human health resource. And so this is a place where if we all are judicious, if we mask and wash our hands and get vaccinated, there's an opportunity to sort of curb that, to not then add on to an already overwhelmed healthcare system, emergency rooms and hospitals of the like.
Lisa writes us an email. I totally support healthcare workers wearing masks, and I also think anyone in any part of the hospital should wear masks. The hospitals and nurses are clogged with people and work, and it only helps if the large stores and public event places should encourage, and in many places step up and say you need to wear a mask to come in. So another thought there from Lisa, echoing what we heard earlier, to expand requirement or asking people to wear masks in those larger public settings as well. Dr. Gregan, what do you think would be the response from the public? You know, where are we in this pandemic when it comes to the public's approach to it and views of these kinds of rules?
I'll suggest that there's not a singular public view, but a whole slew of public views. Everything from please, as a couple of our callers said, have more masking. Undoubtedly, there'll be some who won't want a mask across the province. And so there's not a singular public view. What I want to believe is, for the sake of our elders, for our vulnerable, and for our healthcare workers, people will abide by the rules, and we won't have to get into a place where we have to pass laws around threatening healthcare workers as we had to a couple of years ago.
And what about COVID-19 itself? We've seen now these more slight variations in the Omicron strain or variant. And now another vaccine that targets it specifically. I mean, do we see this as the pattern, the way of the future then?
Viruses are as viruses are. They mutate. That is what they do. They evolve. Sometimes they become more potent, sometimes less potent. I think, the best protection is, again, masking, hand washing, vaccination. And so I'd love to get to a place where there is no more COVID, but I think we're moving from the pandemic phase, when this has affected us worldwide, to the endemic phase, where COVID alongside RSV and influenza are part and parcel of our healthcare system. Okay. And it's our responsibility as healthcare workers and as the public to look after one another.
Dr. Gregan, thank you very much for your time.
You're very welcome.
Now, Dr. Bonnie Henry was just asked about the kinds of settings where masks would be required. Take a listen.
And I know from my own experience that most dentists' offices have never stopped wearing masks, and they wear them as a part of routine. And so it does include, for example, ambulatory care centers that are connected to a hospital. So it would be waiting rooms, offices, where patients are. So it's patient care areas. So the administrative areas where people are, or cafeteria where people are eating, it won't be mandatory in those settings, but it will be in all of the areas where people who are receiving care or who residents are.
Richard. That's Dr. Bonnie Henry, again, the Provincial Health Officer and Health Minister, speaking within this last hour around masking requirements. As of next week, October 3rd, medical masking will be required of healthcare workers and volunteers and visitors at healthcare facilities in those areas that you heard, as well as visitors to long-term care and assisted living facilities. Vaccination will begin for the public October 10th. Much more coverage of this throughout the day here on CBC. I'm Michelle Eliot. Thanks so much for tuning in to BC Today. Have a great afternoon. We'll talk tomorrow.